Hey guys, my name is Kaiser. I'm a student physical therapist assistant with Jeff State. Today we're going to talk about cellulitis. All right, so the pathology for cellulitis, what it actually is it's just an acute bacterial infection that begins to spread throughout your body. It happens when the skin barrier is impaired or broken, and it causes an inflammatory response. The etiology for cellulitis is contracted by either strep or staph. Other pathogens may also be responsible for it for diabetic patients. A lot of times it may be Pseudomonas. It could be from a insect bite or animal bite, and it also could be caused by exposure to pathogens in salt water or fresh water. Disease mechanism, it is contracted, like I said earlier. When a person has an opening in the skin, it gets into the bloodstream through either a cut, scratch, insect bite, cracked skin, or an ulcer. The bacteria begins to grow very rapidly, and then the body has an inflammatory response. This can result in redness, swelling, heat, pain, just pretty much any symptoms you get when you have an infection. Common ways to diagnose cellulitis are the best way is going to be through a physical examination, where a doctor will talk about patient history and just examine the patient, see if he or she sees any areas of inflammation, swelling, and just kind of ask some questions. Other ways that you can do it is you can do a blood count test, you can do a blood culture test, C-reactive protein test, and you can also figure out if a patient has cellulitis by imaging tests like an X-ray or MRI. If cellulitis does become septic, it can severely change your lifespan. Um, when it becomes septic, it can get into the organs and would lead to impaired organ function. It can cause tissue death, and mortality rates go up 20% when it becomes septic. So, you really early intervention and taking your antibiotics is going to be some of the age groups that are affected. So you have middle-aged people, older, elderly people, and young children. Middle-aged population. A lot of times these people are getting older, so they're going to have weakened immune systems. Same thing with older population, underlying conditions and poor circulation. Middle-aged people are a little bit more active than older people, so they're a little bit more susceptible to stuff like cuts and scratches and insect bites and stuff like that. So that's why they are, at least that's why I think they are the highest population according to research. Young children are going to be susceptible for those same reasons. A lot of times they fall, they scrape their knee, they do stuff like that. And they also have undeveloped immune systems. So, got to be careful. The prognosis for cellulitis is actually very good if you take your antibiotics. It's important for early intervention and early detection. If you are feeling bad or you have a fever or you're feeling pain or you're feeling any other symptoms that were listed, you got swelling, it's important to go to the doctor and get that early detection to see what you have. And if you do have cellulitis, it's important to start antibiotics immediately. Some common underlying conditions that people have um, make cellulitis worse. That could be diabetes, lymphedema, um, venous insufficiency, just to name a few. Medical treatments are going to be antibiotics. You can take those either orally or you can do intravenous antibiotics. It just depends on the severity of the cellulitis. Also, lymphatic drainage is an effective treatment. Impairments, limitations, and disabilities associated with cellulitis. So your impairments are going to be pain, reduced range of motion, reduced mobility, swelling, and skin breakdown. Some of your functional limitations are you just not going to be able to go back to work for people who work. For people who play sports, you're not going to be able to do your normal sports activities. You can also see difficulty with transfers, movement, and just gait period. As a result, a patient may be disabled in many ways. They may not be able to dress themselves. They might not be able to bathe properly and stand for long periods of time. Here's where we come in. During the acute phase of physical therapy, we're going to really be focused on controlling inflammation, controlling swelling, and just making sure they preserve some range of motion. Um, During the subacute phase, we're still going to be working on the same thing, restoring range of motion, preventing, it from getting any worse, and lightly working on venous return. Wearing stuff like a light sleeve or something, just until that infection is fully out of their system. Um, Once we can get the infection fully out of their system, we can start to work on strength and endurance training. They can wear a full compression garment daily to promote venous return and to help with edema. Um, and they can get back to those functional tasks, like working and participating in just everyday activities. Some precautions that you should be aware of: the patient and the therapist both have precautions. The patient should avoid at therapy, avoid getting into a pool, avoid any strenuous activities, and just the therapist should be aware that some of their underlying conditions may prevent physical therapy or make physical therapy hard, and they'll have to alter it. For the therapist, you got to make sure you're washing your hands before and after treatment, and you're wearing proper PPE. Also, for the patient, be aware that cellulitis can spread very quickly throughout the body, and that you have to be taking your antibiotics, taking them the whole time that you are still positive for the infection. You got to make sure you take those. Also, the patient needs to make sure that they are cleaning their wounds at home, um, just being clean. The treatment plan. So a treatment plan we really want to focus on in physical therapy. We want to focus on wound care. We want to focus on modifying everyday activities, making them easier, managing those underlying conditions, preserving or progressing physical function. We want to make sure we educate the patient, and we want to ultimately prevent further complications. What a physical therapy session might look like if a patient has cellulitis. So you're going to start off with just a screening, asking questions, doing measurements, seeing if their swelling went down, checking vitals before you start. Then a good thing you could do next is position the patient to where you can promote venous return. You can work on range of motion exercises and functional training next. And if it's indicated, if they're further along in their phase, and not necessarily in the acute phase, you can do some manual to get some of that lymphatic stuff out and promote that venous return, patient education, and then at the end, obviously, finish off with a modality to decrease edema. Some of the goals for PT, short-term goals, like I said, is going to be to decrease pain, reduce inflammation, and just prevent uh, further spread of the infection. Long-term goals are going to be to get them back to work, and back to doing ADLs, regain full range of motion, have no signs of infection from taking their antibiotics, promote good skin integrity, and just regain full strength. In conclusion, it is important for a therapist to be aware of all of the risk factors and the populations that are most at risk for cellulitis, and just educate their patients on what they need to be doing and how to prevent cellulitis, and if they do have it, how to keep it from getting worse. So yeah, that's cellulitis. That's a little bit about it. PowerPoint and just learning more about cellulitis. Thank y'all, and have a good day.